This is an instructional video on how to document a patient's home medication and reconcile them on admission. Firstly, ensure that you have the correct patient at the top and ensure that allergies have been recorded. If you select this button, you'll be able to add any allergies that the patient may have. You also have the option to add any adverse effects, sensitivities, side effects, and so on by using this task. You can search for the substance that the patient is allergic to by looking in this search box and searching for it here, and you'll be able to find the item and select OK. It'll prompt you to fill out a reaction. If you do not know what the reaction is, you can also search for unknown. Select the item and select OK. It will also ask you to complete a severity and the category of allergy. If you're unable to obtain the allergy status within an emergency scenario, you can also select unable to obtain. If there are multiple allergies, you can also select OK and add new, and this will allow you to add on more allergies in one go. Once you select OK, you can see that the allergy has been added onto the patient's record, and you can select OK to come out of this box. And as we can see, the allergy status has been updated to reflect what the patient's allergies are, and we can view this by either selecting on the Allergies tab underneath here or selecting on the Allergies tab within the menu. Navigate back to the doctor's view and ensure that you are in the Admission tab at the top. Within the Admission tab, this will pull out lots of different things that you can scroll down to, but we will be focusing on home medications. We can start to complete a medication history for patients as we clerk them in by selecting on this button here. If a patient has no known home medications, you can select this button, and again, if in emergency scenarios you're unable to obtain information for the patient's medications, you can also select this tick box here. If you want to add an item, you select the Add button in the top left and search for the items that you would like to add. You will see that there are some pre-populated order sets for medications. However, if the patient is not taking any of these, you can select on what is called the primary and free type what suits best. Select Done. This will pull up a box with all the information that you may need to complete for a patient. So the dose should be included, the route of administration, the frequency, and any other relevant details that you would like to add. You can continue to add medications in this fashion that the patient is using. If there are pre-populated order entries that fit your patient's criteria, you can use those. You can still choose to amend these. So if you find that actually you would like to change the frequency, you can still do that and save a bit of time there. Once you have finished documenting your medication history, you can select the Done button at the bottom here. You'll notice that this Leave Med History Incomplete has been greyed out. This is because this will be reviewed by a pharmacist at a later point, and they will be able to sign off the medication history as complete once they have had a chance to add to it if appropriate. You can then select Document History And you can see here that the home medications have been added on. You can then select on admission, and this will give you the opportunity to add medications to the inpatient drug chart. To do this, you will use this column here, which is known as the play column or the continue medications. And for the medications you would like to continue, you would simply add them on like so. Again, these blue circles with the white crosses denote that there is information missing before you can sign off the prescription. If you select it, you will see that there are yellow boxes highlighting what information is needed before the prescription can be signed off. Ensure you complete all these fields. If a patient requires an additional dose at the point of prescribing, you can also select yes, and this will come up on the medication chart for a dose to be given immediately. Once you have completed your reconciliation, if you wish to add any further medications, you can do so by searching using the Add button at the top and searching for the medication here. The green buttons denote that these medications are formulary and therefore available for use on our formulary. Select the medication and click on Done. For antimicrobials, you will be asked to include the indication, as well as the duration. Once you are happy with your medications here, you can select on the Sign button in the bottom right corner. And it is always a good idea to double check what you have prescribed against the drug chart. If it is not already showing, you can select the Refresh button in the top right, and this will pull through any changes that have been made. If you would like to see the quick reference guide for this, you can explore this on eCoach. Otherwise, you can get in touch with a member of one of the pharmacy team on your ward or a member of the digital team if necessary.